Okay, so if anybody would like to review the material that we've talked about, or go a little bit deeper and get all of the scientific references for the things that I have said, you can go on the online platform called Medium and just type in my name, Amy Rothenberg. I have about 40 articles up on Medium, and 10 of them are part of a series that I wrote called You Finished Treatment, Now What? Information and help for survivors and those living with cancer from your local naturopathic doctor.
And it's called Medium?
Medium. It's like, the Huffington Post is one platform, Medium is another platform. Yeah. And I did it in this calendar year, so it's very current. Last night I just went into it just to review it as I was preparing for this talk, and I added a couple of more references of studies that have come out since I wrote those earlier versions, the earlier episodes. So, and I have here information about the cancer connection, which we're going to definitely talk about when we talk about the role of community and connection. And I also have some flyers here about the Naturopathic Oncology Foundation. That's a free organization, nonprofit, started by naturopathic doctors who do only oncology. I'm a general practitioner. I see people with all kinds of problems, pregnant women, little kids with runny noses, people with allergies, menopause, arthritis, autoimmune disease, a lot of that going around. I also do work with a lot of cancer patients. So, but there are some naturopathic doctors who specialize and only see cancer patients, and they've created this nonprofit that is wonderful, Naturopathic Oncology Foundation. Lots of great free information on that website.
Can you talk about dairy?
Can I talk about dairy? One of the very first talks I gave, I was living in Omaha, Nebraska. I gave a talk about the problems with dairy. Come to find out, I was talking to an entire group of dairy farmers. Step 101, know your audience. The problem with dairy is that it's fine for a lot of people. It's fine. And for other people, it's not so fine. There's been no great research. They've tried to see if there's a correlation between people who overdo dairy and develop cancer, and they really haven't found it. What I would say to people is, you're going to have dairy, have full fat dairy. Don't do no fat, don't do low fat, do full fat. Your yogurt, your cottage cheese, your milk. And I would say your best dairies are those that are fermented. So things like yogurt, kefir, fermented cottage cheese, things that have gone through that process, because the fermenteds, they basically help make a microbiome. The microbiome is in this area between your clavicles and your hip bones. You have all your organs and you have your integument, and everything in between is considered your microbiome. And we are made of a multitude. We have many, many organisms in us, and the more we have, the more varied and the more robust, the healthier we tend to be. About 80% of your immune system arises from your gut. So if the gut is really robust like that, you're going to have less problems getting sick, you're going to have less issues with allergies and asthma, and hopefully also less tendency to develop cancer or have a recurrence of cancer. So we work a lot on the microbiome through our diet, through some supplements, through not doing things that ruin the microbiome. So antibiotics, life-saving drugs, essential life-saving drugs, also terribly overprescribed, and they have caused one of the biggest public health crises we have in the world right now is antibiotic-resistant infections. And so part of why that has happened is that we have been giving them too often, too many people. And so this is where naturopathic medicine comes in. If you have that bad cold, if the child has the earache, if you have some kind of infectious diarrhea, there are naturopathic approaches you can use for those things so that you don't have to take the antibiotics. So if I have a cancer patient or a person who's a survivor and really working hard to prevent recurrence, I'm all about, let's keep you off antibiotics. Because when you affect the immune system, you're affecting the immune system's ability to go around and get after the cancer cells too. Antibiotics, they're great at killing that bug, but they kill a lot of the good guys too. Once in a while, they're absolutely indicated, and I'd be the first person to go take one, and we recommend somebody take one. So it's just understanding the less is more theory there with antibiotics. In terms of the head game, question, yes?
So worst case scenario, if you have to take antibiotics,
yeah.
What kind of probiotics should you take, or should you not?
Yeah, if you take an antibiotic, you want to eat cultured foods. You want to eat them anyway, but things like sauerkraut, the cultured vegetables, kimchi, anything from the local company, Real Pickles, fantastic. the cultured dairies.
So that works as well as, or better than a pill?
We know that when you take an antibiotic, it's going to be absorbed better if you're also eating cultured foods. And you don't need a bowl full, and you don't need a whole jar of kombucha. If you buy a jar of kombucha, it can last you a week. That's the amount you need, like sips, forksfuls, spoonfuls, like that. And then also take a probiotic. There are different brands of probiotics. Some are shelf stable, some are not. Some have particular bugs in them that we think about. This is more related for the urinary tract. This is more related for lung issues. This is more related for somebody with anxiety. Because the gut-brain connection is very direct. People that have the gut that's out of whack are often more depressed, more anxious, and more irritable. And I see this with children in my practice all the time, not related to cancer. If you've got a kid who's really a problem, difficult to control kind of kid, and you work on the microbiome as well as some other approaches, you can really help calm that kind of crazy energy. It seems people are like, how could that possibly be related? That's here, that's there. Well, now everybody's starting to call, in my circles, the brain is the second gut. So in terms of brands and stuff, I think it would just depend on what the situation was, but I would have people take a probiotic even while they're taking an antibiotic. And now I've seen some patients in the hospital as a favor to some doctor friends of mine, and they're now prescribing probiotics, very commonly. You want to present, particularly in nursing home setting, hospital settings, to try to prevent C. diff. Give them the probiotics. So, okay, the head game. Remember that a lot of things can lead to inflammation, anxiety, depression among them. And we know that people who are depressed tend to get worse physical symptoms and have poorer outcomes. So if I see a patient with cancer or in recovery or trying to prevent recurrence and they're struggling with depression, I really want to help them address the depression. And I'm not a huge fan of SSRIs, and I'm not a huge fan of benzodiazepines. They have all kinds of side effects. There's an incredible study talking about length of time from original diagnosis of ovarian cancer in women that take SSRIs is much shorter than in women that don't take SSRIs. That's an important study to know about if you have ever had ovarian cancer and are taking an SSRI. It impacts, obviously, depression impacts so much in terms of family dynamic and ability to work and all of that. So what do you do with somebody? Many people got depressed because they got cancer, but some people were depressed beforehand. A lot of people get anxious after they had cancer because it's like crazy making. Some people were anxious or depressed before they ever had cancer. They have a long family history, everybody in the family is anxious, There are lots of tools in the naturopathic doctor toolkit to address anxiety and depression. We will basically work on the microbiome, like I just described. We'll try to see if there are any known triggers. I believe that people have stressors in their life, and the stressors, sometimes we can remove some of the stressors. Sometimes you can't. But if you can, I'd like to have that conversation. Is there anything in your life that you know is making you very, very anxious? Do you have to... some things you can't remove. You can't remove that child from your life. You can't... The things you can't do. But sometimes maybe that job is really not the right job for you. Is there any wiggle room? We really try to have that conversation, see what the biggest stressors are in people's lives, because stress is killing people. Stress is killing people in all its different manifestations. I really believe that. Then I work on, I have this image, what's in the toolkit? What do we have in the toolkit to address the head game? Mindfulness meditation, guided imagery, deep breathing, alternate nostril breathing, exercise. Here, right again, exercise is right at the top of the list to help both prevent and treat anxiety, depression, irritability. What's in that toolkit? Joining a group, being involved, volunteerism. These are all things that can help lift people out. And some people will say, look, I just have chemical depression, I just need to be on these drugs. And a lot of people have been on an SSRI for 20 years, and they don't know what life is like off of it. And their life is a little bit curtailed, so they don't ever get really down. They also don't ever really get up. And they're living life like in here. And if that's where they want to be and that's where they're comfortable, it's a no judgment zone. I offer the information, and we might try lowering the dose. Every side effect in all of medicine is dose dependent. So if somebody's on a lot of something, you get them on a little bit less, is good. And sometimes people are taking one drug and it causes side effects, so now they're taking a second drug. The classic one is people who have a little bit ADD, they're taking the Ritalin, and of course now they can't sleep. So now they're taking a benzodiazepine to help them sleep. Then in the morning they're really, really tired. They need, it's a bit of a challenge, and we got to take it one thing at a time. The goal is not to get people off of drugs. The goal is to have people feeling better, and I try to take it just one step at a time. And I always talk to the prescribing doctor if I didn't prescribe it. What do you think we can lower this by, a fifth every third day? If we're trying to get somebody off of Ambien, you go very slow. These drugs are addictive. People need more of them to get the same effect. They are hard to get off of. People get terrible withdrawal symptoms, so you have to go very slowly and support people in that process. But I just bring it up here because I know a lot of people are like, what are the vitamins I should take? I'm like, yeah, the vitamins are important. We are going to talk about them in a minute, but you got to deal with the head game, and you got to remember that everybody, and people feel this to different degrees, but everybody has some self-agency and some capacity to make change in their life. So if things aren't working, hopefully, if things aren't working, they can do something different to have a better quality of life. Hopefully. All right. Let's talk about herbs. Herbs. Botanical medicine. Botanical medicine, of course, has been around forever. Is this mine?
Yep.
Okay. Of course, many of the drugs that are used in the pharmacopoeia in America are derived from botanical medicines, and many of those used in chemotherapy were derived from botanical medicines initially. Vincristine, a lot of the chemotherapies used for leukemia came from vinca, the vinca plant. I mean, they create it now, synthetically, but originally. Also, the taxanes. If anybody took Taxol, a lot of people took taxane. Those are originated from a botanical medicine source. So the first botanicals that I love to talk about, and Joan already spoke about them a little bit, are some of the culinary herbs that have so much anti-cancer power. Ginger, garlic, onions, turmeric. It's just like they're loaded. I just have a big pile of onions and garlic in my house. Pretty much every vegetable I make, I'm sauteing some onions and garlic first, then throwing it in. They're very, very good for us, and you can eat them liberally. There's like no amount that's too much, really, unless you're allergic to it. Ginger is in that category as well. I love to grate ginger and turmeric root. I mentioned that earlier. Green tea, we talked about a little bit already, has some wonderful anti-cancer components. There are many studies that talk about the amount that you have to have, 5 or 6 glasses. We already said this, too much for most people. I give it in a pill form, as well as encourage people to drink it. And it's because of its antioxidant qualities. That's why it's good. The antioxidants again. Resveratrol is a group of chemicals derived from the seeds of red grapes. It's high in wine. Don't get too excited because next thing I'm going to tell you is don't drink alcohol, but we'll get to that in a minute. Resveratrol is a wonderful antioxidant and has anti-cancer effects. So this is an herb that I would give people to take in a pill form if they're trying to prevent recurrence. It's also important to know which herbs not to take when. There are certain herbs that interfere with chemotherapy. There are certain herbs that interfere with estrogen blockers. There are certain herbs that interfere with PARP inhibitors. These are all different kinds of chemicals, anti-cancer chemicals. So if you're wanting to dabble with herbs, talk to somebody who knows what they're talking about, because you don't want to be trying to do something healthy and actually be hurting yourself. And then the other ways that I like to use herbs are for mopping up after chemo. Like the main kind of problems that people come in with, low blood counts. We use herbs like dandelion, burdock, yellow dock. These are herbs that are fabulous for raising the red count. Floridex is a wonderful combination herbal remedy for low red count. Sometimes people come in with with lymphedema, and there are wonderful herbs to use for lymphedema. Phytolacca is one of the best herbs for that. It's a toxic herb. We use just a few drops of phytolacca in with some other herbs that are good for the circulation, like crataegus. There are some wonderful herbs for that. We also use a lot of hydrotherapy for people that have lymphedema, alternating hot and cold to the hands. Of course, lymphatic massage, fantastic. Other things people come in with, brain issues after chemo brain, radiation brain. We use things like low dose lithium and bacopa to help with the memory. A tiny bit of lemon balm. If somebody's very anxious, we can use lemon balm, lavender, chamomile. Some people have tremendous weight loss after they've been through cancer treatment, and there's lots of ways we use mostly food in that way, but things that are appetite stimulant, a little bit of gentian violet appetite stimulant. And then we have a lot of problems with insomnia and fatigue. They're related. You're tired because you're not sleeping, but sometimes the insomnia is just runaway insomnia. We will often use lavender to help people, just in terms of the herbal things, chamomile, the things that are soothing and relaxing. GI complaints, people come in, either they got these things from the cancer treatment, or they had them pre-existing conditions. They had gastroesophageal reflux, or they had the whole list of the whole DSM-10, all the things people can have. Herbal remedies can be pointed to those so that we can help people avoid taking another drug. Because what we have now is we have 40% of people over the age of 60 are on 4 or more pharmaceuticals in America. It's a really bad number. And every year it gets worse. Every 10 years they study this. And so what we don't know is what is happening in terms of polypharmacy inside a person. If you're taking 6 different drugs, nobody's testing 6 different drugs on people. And a study came out a few weeks ago about the more drugs you're on, the more risk you have of death. I mean, it's kind of a crazy study, but it just is basically like, it's not good to take a lot of drugs. So you've got to take the ones that are really essential, and the other ones, see if we can't use some herbs, perhaps, to help. So like if someone comes in, they have gastroesophageal reflux. Prilosec, number 1 drug, one of the number 1 drugs in the country. Zantac, I don't know if people saw the study, came out last week. Zantac breaks down the body now, shows carcinogenic metabolites. Zantac. You know how easy it is to get Zantac? It's over the counter. But there's so many fabulous, so people are going to go to their doctor and say, I got to get off my Zantac, I'm afraid I'm going to get cancer. The doctor's going to put on PPIs. Well, proton pump inhibitors have been associated with everything from cognitive decline to osteoporosis to death. To death. That's like one of the side effects of Prilosec. So we can use all different kinds of natural medicine, including herbs, to help with gastroesophageal reflux. So slippery elm is a beautiful herb for that. We can use DGL, which is deglycerinated, glycerized, a licorice root extract. We can use aloe vera juice. We can do all the lifestyle things that help with reflux. Raise the head of the bed, don't lay down after you eat, don't drink coffee. And a lot of people think that, you get the advice, don't drink coffee, don't eat citrus, that causes reflux. It doesn't cause reflux. Reflux is caused by irritation. Again, inflammation, irritation, loosens the sphincter between the lower part of the esophagus and the stomach, and then you get the regurg. So we want to do things to tighten up that sphincter. There's lots of things we can do to do that. Yeah?
Can I ask, you were talking about red blood cells.
Yeah.
What about white blood cells? Because they'll be neurogen.
Right, you get neurogen for the white blood cells. You can do things that help your white blood cells. I usually use a combination Chinese medicine formula. It's called Immune Boost. I think it's made by Seven Forests. You'll quote me on that. But you can call me if you need that information. Because I think that's not the right exact name of the product. It has a number of different herbs in it that are immune supporting.
Paul Stamets.
Paul Stamets, we use the mushrooms, exactly the combination, 7 mushrooms in the 1 container, powder, no taste, cheaper than buying them in capsule form. That will help raise white count as well. That will help raise the white count. Okay, so we have botanical medicine. It's just something to think about, very effective. The dose has to be right. You got to get the right form for you. Herbs can be taken as teas, tinctures, capsules, hard-pressed pills. There's lots of ways to take herbs. I try to figure out the kind that person's going to be most compliant with. Everybody's different that way. Okay, any questions about herbs? Yes?
Who studies the drug-drug interaction with the herbs?
Drug-drug interactions with herbs are actually quite a studied thing. You can go on the internet and you can type in drug-drug interaction checker.
Yeah.
And if you can put in many, many herbs, not every single herb, but all the common ones, that will be on there. And it's very important to do that because you don't, again, want to take things that are not good for you. Okay, so I've got a couple more sections here. It's almost 8 o'clock. Well, we'll just zip through these. Off-label use of pharmaceuticals. There are hundreds and hundreds of drugs that have a long history of use in this country and abroad. And many of them are being studied for their off-label use in the treatment of cancer. The most common one that has shown the most positive effect is metformin, which also has a derived from an herbal substance to begin with. Metformin is used for people who are pre-diabetic. I take metformin. My blood sugar is quite low. My A1C is very low. I take it as an anti-cancer. It basically helps enhance insulin sensitivity. It has a very, very low side effect profile, and it's very cheap. So particularly in countries where chemotherapy and radiation, other treatments are out of reach for people, some of these drugs, chloroquine has been showing some terrific anti-cancer effects. These are drugs that are pennies a dose. Do you know what I'm saying? So I'm just throwing it out there. If you are somebody's working with your oncologist, you can say, I went to this lecture, she said, maybe I should think about taking metformin. What do you think? And the reason it started getting studied about 20 years ago was because they found that people who were pre-diabetic going through cancer care, taking metformin, had better outcomes than people who were not pre-diabetic and not on metformin. That opened a lot of eyes. So, something to think about. There are some side effects of metformin if you take too much, diarrhea, but most people adjust and get used to it. If you don't want to take metformin, you could take the herb berberine, which has a similar effect to metformin. The problem with berberine is that it's very expensive. It's very expensive. You know, metformin is a few cents a day. Berberine is more than that. So, okay. Nutritional supplements. There's so many of them. And I have to go with how much money does a person have? How many pills do they want to take a day? What's their diet like? What's the cultural stuff that I need to be thinking about? And I also need to understand what kind of cancer they had, what kind of treatments they took, what kind of side effects they have, what kind of other physical symptoms they have going into it. You're going to give the prescription of the nutritional supplements based on the whole person. But I can tell you 5 that every person who's ever had cancer should be taking, in my estimation. Curcumin, which is derived from turmeric. It just, in every study, across cultures, across cancers, across body types, across age groups, it has anti-cancer effect. The thing with curcumin is, though, you have to take a lot. You can't take one little curcumin pill a day. You need like a couple, 3, 4, 5, 500 milligram curcumin a day. If you did 1 3 times a day, like 500 milligrams 3 times a day, that would be a therapeutic dose of curcumin. It basically suppresses the initiation of cancer production. It has shown to prevent metastases in a number of different kinds of cancers. And it does that by reducing angiogenesis, again, making those little blood vessels, and it interferes with tumor growth. And they do this on the cell line, they do it in the tissue line, so it's really a powerful herb. Green tea, we've talked about a few times. EGCG is the chemical combination that's within green tea, and it has decreases metastases as well, and it inhibits tumor invasion. So green tea. Mushrooms, so much research on so many different kinds of mushrooms. I mean, you could take maitake mushrooms, you could take lion's mane mushrooms, you could take the little white ones that you grew up eating, you can take reishi mushrooms, it doesn't matter, they're all good. Eat them and take them in pill form. Get the Stamets 7 mushrooms in a powder and take a half a teaspoon of that a day. It's really powerful stuff. If you,
What did you say?
yeah, it's called Stamets is the brand. Is that the brand? I think it's
Spell it. Healthy Defense.
Stamets. And it's a powder. It has no taste, and you just do about a half a teaspoon to a teaspoon a day. You can put it on
Drops of chaga.
you can do drops of chaga for sure. Some people aren't going to do it because it doesn't like the taste, you know.
Get used to
You
it.
get used to it. If you want to eat mushrooms, the main thing about know about eating mushrooms, eating them raw, you don't get much of the medicinal quality. We don't have the enzymes needed to get through the chitin, which is the plant cell membrane wall. We can't do that. So they're best if cooked, but if you overcook them, you also don't get the benefits. So lightly cooked, quickly. not don't overdo it. So eat mushrooms, take mushrooms. Quercetin. Quercetin is a bioflavonoid. That's basically like if you have an orange, inside the orange is vitamin C, inside the white part is bioflavonoid. And bioflavonoids, people use them a lot for allergies and to stabilize the mast cell in the blood. The mast cell is the one that releases histamine and causes itching and inflammation. But quercetin has also been shown, it's in lots of fruits and vegetables, it has anti-proliferative effect. So it makes it so the cancer cells don't reproduce, but it doesn't affect the other healthy cells. It also supports apoptosis, which is that natural cell death.
How much of that is it?
Quercetin, you could do 500 milligrams once or twice a day. Melatonin, a lot of people have heard about melatonin for sleep. It also has a very strong anti-cancer effect. I do have people take it at night before bed. It helps to mitigate both the creation of new cancer cells and the excessive reproduction of cancer cells. Melatonin separately also helps to stabilize the sphincter at the bottom of the esophagus. So as many as gastroesophageal disease, we use melatonin as well. Interesting.
How much?
Melatonin is interesting. I have some patients who've been taking 20 milligrams a day, for an anti-cancer thing for years, decades. Most people can't take that much. They get crazy, whacked out dreams. The starting dose, I usually start people with 3 milligrams. If they tolerate that well, I usually give them 6.
And does it matter if it's like?
Sustained release?
Yes.
Does not matter.
Okay.
Does not matter. If people are using it for waking in the middle of the night, then we do sustained release. But for a lot of people, they don't have problems with their sleep. They're just taking it for the anti-cancer effect. Those are the 5 that I feel like are good. And then most patients I see, I'm probably going to I might take one of them away, but add 4 or 5 others based on what they had, who they are, what else is, in your picture.
You said quercetin, you said 500 2 times a day?
Yes, quercetin twice a day.
And green tea sometimes interferes with some chemo.
It does, but I'm talking about people who are after treatment, in the sort of prevention of recurrence. Whole person medicine, just quickly, homeopathy and acupuncture. I use homeopathy, I refer to acupuncturists. Acupuncture has been shown to help so much in terms of fatigue, mental health, etc. Homeopathy is a beautiful, gentle medicine to address particular symptoms a person might have. And then lastly, social connection. I've kind of alluded to it, but very important to have that in your life as part of the preventive urge. The Cancer Connection offers so many amazing programs. I mean, it's just incredible. So if you don't know about that, that's a great thing to know about. Some people don't want to identify with having had cancer. That's fine. There's plenty of other ways to be involved. But it's shown now that people have a better outcome with their cancer if they're not feeling isolated and alone. It's not rocket science, but it's nice to see the research supporting that fact. All right, I am here for your questions for a little while. It's after 8, so if you need to leave, it's totally fine, but I'm also happy to stay around and ask questions. Yeah?
About oils and cooking oils?
Yeah, cooking oils. You want to use coconut oil, if you like the taste, olive oil. I like walnut oil and avocado oil. I also like ghee, if you don't have a dairy problem. Most people with dairy problems can take ghee anyway because the protein's kind of been taken out. Those are the most important oils, but I also love people to eat foods that are high in oils. Nuts. Nuts are like a miracle food. Everybody should be having at least a handful of nuts a day. The only nut not to put in there is peanuts, which is not really a nut, it's a legume. It's not like it's a bad food, but it doesn't count as a nut. Nuts are very good. Nuts and seeds, sesame seeds, sunflower seeds. And then also avocado. Avocado is a fabulous, fabulous kind of fat. The whole thing about fats is that when you eat fats, you better absorb your fat-soluble vitamins, A, D, E, and K. And those are all very important vitamins to be absorbing to have their anti-cancer effect. So you do want to get your fats. I told somebody recently, I only want you to have full-fat dairy. They were like, thank you, God. They were like so excited.
Is lactose-free, what is lactose-free when you have yogurt that's lactose-free?
Yes, they
Doesn't
take.
have the bad stuff that dairy can do.
Well, lactose-free yogurt doesn't really make sense because the yogurt process kind of does away with the lactose anyway. So lactose-free milk just means they've taken out that part of the milk sugar, and people who have lactose intolerant will be able to tolerate it better. So, yeah. Okay. What else can I tell you? Any other questions about anything? Oh, I do want to say one thing. Nobody can do everything. Nobody can do everything. So I know I laid out a lot of information. I'm trying to be thorough, but don't feel like you have to do all of this, because you'd be totally overwhelmed and depressed. Oh my God, I can't do all that. Pick and choose a few things. Every year, add another thing. Try something else. Understand that your body reflects the habitual, not the occasional. So if you have the occasional fill in the blank, it's not going to give you cancer. Don't make yourself crazy, and don't make everybody around you crazy. Do things in moderation. Alcohol, which I could talk about under food, under drugs, or under herbs, there's no safe amount of alcohol in people who have had cancer. That's just in all the medical literature. It's not just me making that up. There's really no safe amount. So if you're somebody who drinks 2 glasses of wine a night, and you always have, cut it down. Get it down to 1 glass a night. Buy smaller glasses. Then have half a glass. There's really no amount. It has to do with the sugar level and the impact on the liver. So sadly, I'm sorry to say that. Yes.
I did have one question about the supplements.
Yes.
Are there specific sources that are important?
I would say that for the most part, the supplements that you can buy here are good quality at Whole Foods. I don't know that I would go to CVS and buy my supplements. There are brands that are better than others. They are vetted. There are organizations that vet supplements. I use a company that does that in my practice, so that I know that when I recommend something to patients, I give them the exact brand I want them to get. Because I want to get the ones that have the fewest amount of excipients, binders, fillers. I want organic if possible. I want fresh if possible, local if possible. So I do recommend specific brands, but that's just me, And it's better to take it than wait, But yeah, every turmeric is not the same. And you can tell yourself, if you open some capsules, the color, the smell, the taste.
Some have the root, some have.
Exactly. And with herbs, you need to know which part of the herb you're using: the root, the leaf, the whole plant.
Anything from Friends Farm, because they grow their own turmeric.
Oh yes.
And so
Old Friends Farm.
They're local, Old Friends Farm, and so we sell their fresh turmeric. It's not aged.
It's fantastic.
And it's amazing, and any product that they're doing.
It costs a ton, but it's delicious, and it freezes very well.
Right.
So I buy mine. It's not here all year. They're harvested right
here
now. Here now, you buy yourself a couple of those roots, of the turmeric root, and put it in the freezer. And you just grate it frozen right into your oil to kind of warm up and heat. It's so delicious. It's really good for you.
Is there a way to use turmeric and not stain your cutting boards and your hands like ridiculously? 'Cause, it made a mess when I usually use it in the bottle, the Roundup form.
Yes.
I tried buying some root and I still have the stain on my cutting board.
Yeah, I would say no.
Turmeric cutting board.
Separate turmeric cutting board. Maybe that's it.
So, I use a plate instead of a cutting board.
Okay.
So I grate into a plate because it's not going
And
to
so chocolate
absorb
and
that.
grating it would also help me.
Yeah.
Right.
Yeah.
So
Or grating it. And I
grate-
think grating it, you access more of the medicinal qualities than cutting.
Okay.
Right.
What was your question?
Was it vitamin D, does that matter if you get it from a special brand?
Vitamin D, less so. It's a little less so. But the best way to get vitamin D is sunshine.
Right.
And I think I forgot the one very important ingredient, which is laughter. The healing power of laughter and joy should never be underestimated. And if you're not naturally oriented in that way, like funny movies are good, listening to funny podcasts are good, getting out of your own way. One of the first questions I ask my new patients in my practice is, what do you do for fun? Good night.
Good night.
You're welcome. What do you do for fun? And I can't tell you the number of people who look at me, their eyes just get wider and wider and wider, and they basically I really just don't have much fun these days. And I think that's back to the first thing I talked about with stress and overwork and always on the thing. So we have to remember to make time for fun and time in nature. Increasingly all the research, 20 minutes a day in a natural setting is very important. We evolved in natural settings, and now we're in these buildings with weird lights. there's so much that we can do toward health, and I wish all of you the best of health wherever you are in your moment, you know, best of health, and if you ever need a naturopathic doctor, you know where to find me. I have an adorable new practice in downtown Northampton because we're finally licensed in the state. So, thank you for your attention.
Thank you.
What's that?
What about the life water, electrolytes?
Yeah, I just think water is good. I'm not sure you need something special. I probably wouldn't be drinking out of plastic if I didn't bring my own water.
I have some delicious locally made don't put it in. No. I'll take care of it.
Oh, I'm sorry. Okay.
Just leave your stuff there, I'll take care of it, all right?
Sorry, I didn't.
All right, you were trying to help, I appreciate it.
Thank you.
You're very welcome. You're
Local
welcome.
I'm gonna start eating mushrooms.
87% dark
You hate them?
chocolate
I ate that whole
So
thing.
on your way out, please enjoy.
So I'm gonna start. I
Thank you so much.
can't not eat them. I just don't enjoy them. But
I
you know what? I
understand.
hear you're selling me on. Everybody keeps saying you gotta have
But
mushrooms.
you know what? If you might think about trying different kinds because they have different tastes. Does the whole concept just gross you out?
Well, that wasn't horrible. That was
That
good.
wasn't horrible.
Just because it was in the soup.
Yeah,
So
yeah.
I got it down.
Yeah. I don't know why I went around there.
I ate all that.
This is how I shop. This is like literally what would be in my shopping bag. Ashwagandha, yeah. Oh, I forgot to say one thing very quickly. If anybody has issues with digestive problems, you guys, I forgot to say something I really wanted to share. If anybody has digestive problems, constipation, adhesions, problems from surgery, feeling out of whack, liver sluggish, my favorite treatment is the castor oil pack. It's so cheap and it's so effective and it's so easy to do. You get a little piece of flannel and you put the castor oil on the flannel. You put a plastic bag over it. You can put it on whatever area is bothering. Breast tissue scars if you have thyroid cancer. And there is wonderful research on the castor oil pack. It's not some naturopathic woo-woo thing. It's
get it at
wonderful
CVS?
research. You can get it right here. Yeah. It's a beautiful, inexpensive. It comes from Indian tradition, castor oil. Ricinus is the seed it's made from, and it's just anti-inflammatory. It's it's analgesic. It's a beautiful natural treatment. So if you have like a bad knee, you know, it's not just about cancer. You put it around your knee. It's a beautiful, nice thing. Castor oil.
There's an Ayurvedic practitioner in
Yeah.
Florence that does that.
Yeah, and we do castor oil packs. I mean, mostly have people do them at home because it's nice to go to sleep with it on, put a heating pad over it, if there's no cancer known in that area. With the
So you
heating
put
pad.
it on the flannel and then the flannel in
And the
some-
flannel against you. The part with the castor oil is against you, and then I usually put like a plastic bag. There are some higher end castor oil pack setups that have a kind of plasticated side, like a picnic tablecloth, and one side's plastic, one side's flannel, kind of like that.
You can just get this here.
Yeah, you can get that here, but you can also go to like Joann's Fabric and just get some flannel, or take an old flannel, shirt. Yeah. You're welcome. You're welcome.
You have openings.
Yeah. Here's my card.
I took it.
I'm in on Mondays and Thursdays here.
I wandered into you, or
Oh,
walked in,
isn't
like a
it
couple
cute?
of months ago,
It's so
yeah.
cute. We love being
It
here.
used to be the travel.
Yeah, you see Travel Medicine Western Mass, Dr. Rose.
I know.
I knocked on the door and asked him if he'd sell it, because I love that house.
Seriously?
I did. I love that house. He said yes.
Which is,
And that's the rest of history. You were the Cancer Connection talk again.
It's really good, huh?
No. Somebody else was just like you there.
It's good.
Okay.
So can you tape that on? Put the flannel on, put the plastic in, and
Those
just
little
look like,
powder.
tape that on overnight,
really good.
or will it
I
not?
wouldn't really tape it. I would like to put on a pair of
always very
underwear
good.
or
Thank
some
you.
clothing that's
My
snug
pleasure.
that you could put under, like a spandexy
my
thing.
pleasure.
Yeah. You can also just lay it over an area and take 20 minutes to rest. You don't have to sleep. Yeah.
Do you have to worry about reactions, for small?
I've never had somebody react to castor oil. I mean, anybody can deal with anything, of course, but I've never had anything.
Any reactions? Or just.
I mostly use it, honestly, I use it for that menstrual cramps, pelvic congestion, bladder infections, interstitial cystitis. Interstitial cystitis is a kind of bladder issue. Incontinence, it helps to firm up the bladder. Nocturia, peeing at night too much, great treatment for that.
If you take it by mouth, does it?
No,
does it
we don't use this by now.
Right, it's only.
It's only topical. Yeah, and then we will also use it in people that have adhesions, like let's say you had women that have had breast radiation and then this whole side is kind of getting like we'll just use castor oil packs on that radiated side. Right from the beginning, as soon as like steam burns the field, go right to the castor oil packs.
Reacts good, like this,
No, it doesn't react to anything. No, not at all. It's very benign, but very effective. It's not going to be a miracle overnight. Although bladder infections, I've had great success. We did the cranberry juice with D-mantle, but also castor oil right here. You're welcome, thank you.
No, you can have it. I'm just
The gauze, it just uses screw too much. The flannel kind of holds it a little better. I thought there was other kinds of cotton too. Yeah. Thank you. You're very welcome.
I know about those.
I called about a week ago before I saw this class about coming to us at college. But it was offices.
In Enfield. We've been in Enfield for 35 years. So it's finally got licensed in this state, so we wanted to, we've been in house. So for us, we just want to closer to home. Yeah. Where do you live? You told me Amherst. Oh, you live in Amherst. Yeah. So it's roughly the north. Mondays and Thursdays.
I'm gonna take a mile.
Linda can help you. You're very welcome. Yes. Not yet. We're hoping, we're working on it. We're working with the national. We're not there yet. I feel we should do it.
Yeah, it's sour and slightly bad.
It's slightly bad. I think the pomegranate is
It's all, oh, shoot.
Both was fantastic.
Okay, I am so sorry, I just went out and grabbed one and the date was right on it, I so apologize.
Sorry. Now they go back. You're very welcome.
I didn't have time to break one open and do it myself.
Hi, that's Ms. Wilson, you're amazing.
Was there any food left?
Yes, are you hungry?
I'll have some soup.
I'll have everything for you.
Oh, I love some,
okay?
thank you.
Do you want to do talks for like breast cancer groups?
Yes.
I just think I should have this at the seminary when we have our breast cancer support.
Yep.
It's monthly.
Yep. Always happy to come in.
3 of the women were supposed to maybe come with me, but I just learned about this 2 days ago and it was hard.
Is that a young woman's support group or it's all age?
It's all age.
All age, yeah. Yes, I'd love to come in. I'm happy to talk about a topic of interest to people.
This would have been phenomenal for the women that wanted to come with me. They would have been eating this up because it's right up your alley, you know? It's the more holistic way of doing things. And
you bet.
They're all post-treatment right now,
Yeah.
but the risk of recurrence is always there.
Right. Yes, yeah, just get a hold of me in my office and set something up. I love, I feel like this is important information to share.
It is. I mean, to me, I went through my treatment. I had breast cancer and I had a single mastectomy in 2017. I only did radiation because I had ulcerative colitis and a bunch of digestive problems. And they were afraid chemo would send me crazy.
Yeah.
So in a way, I thank God for ulcerative colitis because I watched both my parents go through chemo. I don't want to be a part of it.
Got it.
I'll take radiation any day of the week. So, to me, just having gone through that part of it, that was one thing I wanted to ask you.
Yeah.
Where did you choose to have your treatment done?
I had my treatment at Mass General.
Okay, good choice. Okay.
I mean, they made the plan and then thank you, Joan.
Do you want salad and bread with the?
If you have salad, I'd love
I've
some
got
salad.
salad.
I love
And
some.
you would like the bread with avocado?
I love some crackers with the avocado.
Crackers with the avocado.
Thank you so
Got it.
much. Whatever you want. I had the actual treatments in Northampton, the brains were over there.
Yeah, that's what I like about Cooley. I'm thinking
Yeah.
of switching from Bay State to Cooley because
Yeah.
the one experience I had with Cooley was a third opinion about the radiation.
Yeah.
I was blown away by a number of small detailed things that they handled really well. Much
Yeah.
better than I have issues with Bay State, and
Yeah.
people in the group are having phenomenal issues with Bay
Yeah.
State with the breast center. And
Yeah.
so I've been considering, because it's tied to Mass General, with the dietary, she comes to the family and one of my cousins swears by Mass General, where she goes for all that. They have
Yeah.
a Crohn's and colitis center there and stuff. So
Yeah.
yeah.
It's pretty much state of the art. It really is.
do the physicians come out to Cooley from Mass General, like specifically, or do you have to go there?
Occasionally they'll come out and give a talk, but no, I don't go there. I go every 3 months.
Okay.
Check out.
I'm on a 6-month run right now.
Oh, nice.
so-
Nice, good for you.
Hopeful, I'm, 3 years out now, so.
Congratulations.
So, yeah,
Keep
getting
it up.
Getting there.
Keep it up.
Those women in that group are a large part of how I can.
I bet. I'm telling you, the social connection is
Absolutely.
essential.
Absolutely. Thank you so much for being here.
You're welcome.
Thank
Bye-bye.
you, Joan.
Oh, my pleasure. Have a lovely night.
Take care.
You are such a willing I really want to know the scientific thing about
What's your radical?
action, how I still don't kind of get it. I kind of want to get it, but we don't talk about it. Because
Well, just think
there's
about-
a way of like.
Think about a molecule that only has 1 electron.
What do they normally have?
2.
An electron and two electrons.
2 electrons. I mean, they can have more, but like the
But like a
active-
cell, I got confused, I studied all this crap, whatever. I don't know why, I think I like to visualize things, it's fine.
But just think about it, if it doesn't have enough, it's going around trying to figure what to take from you, then it makes this one unstable.
And it's in a group. Well, what is actually a cancer cell?
A cancer cell looks like a cancer cell,
It's the same thing.
but then it takes over in areas that it's not supposed to be. It's supposed to be a breast cell there, instead of being a breast cell, it's a cancer cell. Mm.
Yeah, I'm gonna.
Fantastic soup, I love it,
Thank you.
so good.
I'm gonna do all this eating. I'm already kind of down on the sugar already, so, and it's not hard for me to do stuff, once I get off sugar. It's about maintaining, so I need like quicker intervention if I start eating it, almost, right, because
Right.
I don't have a problem getting off of it,
Right.
just
The
getting.
slippery slope.
It was a slippery slope.
It turned out to be a good turnout.
It was wonderful. Worked out really well and everybody gave money, which was so sweet. Sorry about that.
So nice. That's great, that's gonna be like $130 with Cancer Connection. Whatever it was. Did some people pay and not come?
No, the 2 people that didn't come hadn't paid,
Uh-huh, okay.
so.
Mm. Oh, avocado's so good.
What do you think about Eric's knee?
Yeah, just definitely try it.
So,
Jerry
like,
cheese is no
if
side
you've
effect.
got a bum knee, would you just put that on directly? Like you had a knee?
No, I don't think I would. I think I'd put it
With the
on the flannel,
Uh-huh,
tie it on and rest.
okay,
Yeah,
curious.
this avocado is so good.
Oh, thank you, I just,
Okay.
mashed it up, I put a little lime juice and a pinch of
What
salt.
time is it?
Fabulous.
I just had my last bite.
What time is it?
Oh, 8:21. So 8 to 8, 9, 10, 11. Go to 11 for sure. I don't know.
But you go to 10, if you're not a morning eater, then it's so much easier. But I've become not a morning eater. I used to be.
Because I eat it.
Right. But I used to eat it night. I have pretty fast knees.
But that doesn't mean that
It's so
I
weird.
feel hungry.
It's so weird with Joan. That she's so skinny.
But she's so skinny. She's tiny.
I mean, it's like body shape. She likes it.
She likes it.
She
She
gave
said,
it
I
like-
can eat whatever I want.
I gave her this
Always
weird-
be as much as she wants. Ice cream. Whatever.
At this point, she doesn't eat calories too. But I gave her this pair of this kind of red jeans, reddish skinny jeans. They're like a size 3. I'm really size 3, but they're kind of spandex and stretchy. They look better on her than on me.
Well, sure.
I think it's a little plastic surgery. It's getting better though.
She says she's motivated to do her exercise because of that. She told me it's because of that.
The wobble was horrifying at first.
That's like someone who lost weight.
It's exactly what it is.
Yeah. So you just have to skin it.
Yeah. But it's getting better.
She's amazing. She was really pleasant.
She's a lot of fun.
Yeah.
She was better.
I mean, it wasn't like she wasn't pleasant.
I don't think she was as well. I'm not sure.
I think she's like, it's been a long time of it being sort of stable in this.
I think that's what she needs.
Right. So she knows that her mom is limited. She knows her.
Well, I think also just, I think it's better for her to be in our house and not change.
The reason why I wanted to pick her up, just pack it up. No, because she doesn't.
She can't do the
It
executive
goes
function.
in and then.
So I understood that, so this time I made a list for her.
Yeah. And we kind of went through it and, then we got to the house and what we did.
No, but she didn't feel it was, it wasn't a good list, so we did another list.
We're going to. No, it's really challenging.
It can't be rushed.
No, and.
And then I gave her some presents that people like, knitting and so today we got a call, we wanted to leave at 8, and we got another call, it was like 8:45, he was ready to leave. But John wasn't ready, she needed more, they told me they came 8:45. And I said, the baby time is rushing. She was right. I mean, she was right, you know. She didn't mince words.
No, right, she can kind of get it all together, but it's probably a matter of checking it, over time.
But what was really nice was she didn't freak out. She was really calm, she kept putting one foot on the other, in my head, my questions, my moving. That's what you see a lot.
I know. It's crazy. It's so crazy. I guess we had some grandchildren.
I think we do.
I mean, look, our grandmothers lived really long.
Right? We don't know
I
their
think
father
about-
didn't.
No, we don't know anything about our great grandparents.
Well, yes, we do. Mom's grandmother
We do.
was Gitzel. Gitzel, her name is Gitzel.
Isn't that Dad's mom's name? Sarah.
Gitzel was Seal's mom.
Okay.
She was at 4'11", with hair down to here. I met her. And then you met her as a real baby. But you weren't a baby, though. I remember she was, I must have been 6 or 7, she was blind. She was in a nursing home.
No memory.
She was like almost like a baby.
See?
So mom must have gotten the BRCA mutation from her father, who died in his 30s. Kidney disease. Must have herself. I mean, her mother could have had it, but she lived to be 90 and never get cancer. It's also true that they've known about the BRCA mutation since 20. It's increasing how many people get cancer who have it. There's a working theory behind that about there's just way more toxins in the environment. So the risk is going up as the environment gets cancer.
Yeah, that's quite a while. Because like Dr. said, if I get something, I want to be in like that good shape. And,
Right, but there's still a 1 in each chance.
I know.
So then,
I mean, just for all the other reasons.
right, totally.
Everything. For life.
Is Eric interested in dieting? He just wants to.
Yeah, I try to just like, that's not like, I'm not gonna get into this person. Otherwise I'd be like, always be like the mother, whatever. But he's never changed. He's never changed. If I'm not providing the foods and putting it in front of him, here is this apple, here's your almond. If I'm not doing that, he won't.
What is these before you?
Don't be bad coffee. I'm surprised this is healthy. It takes a lot of energy. I don't even know how to do it. He has a severe kidney. He pops them out. He comes out of that hill all the time. Not all the time, but often. He's like, yeah, I'm past my kidney. So he's used to that pain. It doesn't even bother him. Out of his stone, a big one, like, the size of that thing. But that's not healthy. Then you know what's going on. You just run out of all the time. You like check on what's going on in the water. Do you drink more water? You get a water bottle. Yeah. But very sweet bottle. It's finally gotten, but not consistent.
gonna do this together.
I say it often, not like often,
Yeah.
from time to time, I
Yeah.
say, it'd be really nice that we can cook together and we can eat slowly. He's a, he has this, and it's like, biggest bite of a piece of toast, that fills his mouth, it's like, it's all this hot stuff, like it's a total charge, like all the dishes, like, you goes to where you wasn't enough, what, wasn't enough? It's just soothing and filling a void of lonely, high anxiety, and mother was never there, rude thing, you know. And like, he's, you know, he's getting out, he feels pretty good, but he's not so hot, he's on something, waiting for her. I would like to walk back, because he is sort of, when you were saying, you know, like in this range, and I go high and I go low, and I'm in the middle, and I'm calm and I'm not, and I'm, you know, I'm like all of what's real. You know, he's just like, cool dude. He's just starting to express more of his feeling and talking. But like, he's a naturopath.
Joan, that was a fabulous meal.
I'm so glad.
It was so good. I ate every little bit of it.
Well, you well deserved it.
Thank you.
You did a lot of talking.
I did.
Maybe.
It's a lot of information to share.
It is, but it's very informative. Everybody said how wonderful it was.
Oh, good. Good.
Maybe I can start with a small thing with him.
Several little things were bases of mine.
Oh, okay.
Two of people. So that was nice.
Yeah.
I think I'll probably see a few of them. Might happen. All right, I need to put away all those things.
The only thing, I'll just put the grapes away. The rest of it is all shelf-stable. I can do it in the morning. And then I'm supposed to go
I'll
off.
put the grapes and maybe the mushrooms and the blueberries.
Okay.
And the sprouts.
We need to go back and.
Is it sour? I think it's
No,
sour.
that's shelf-stable.
But even though it's in the fridge this time, it's been used to be.
That was in the fridge?
It was, yeah. So I'm gonna put these away. And the grapes and
Is
the
that a new
blueberries.
one?
I think it's shelf stable. I think they had it with all the other,
Okay, because it is shelf-stable.
Okay, thank you.
The
for
rest
putting
of it I
away.
can put back tomorrow.
Okay, perfect.
Oh boy.
Oh, boy.